Hello, I'm Pauline Grant, CEO of Broward Health North, with an update for you about our renovation project. We held a groundbreaking ceremony on June 25th to signify the official start of our $70 million project, which includes a new central energy plant to maximize energy efficiency throughout the hospital, new state-of-the-art emergency department with 53 rooms, including 3 fully equipped trauma rooms and 6 operating suites, and a new updated facade for our fresh, modern look for our building. In addition, our plans for a totally remodeled lobby feature a retail pharmacy, so our patients will have the convenience of going home with everything they need for recovery. I'm personally excited about all the upgrades and changes here at Broward Health North, and thank you for your continued efforts to always provide high quality care and a 5-star experience for our patients and their families.
Mr. Frank Nask has been at the helm of Broward Health as the President and CEO since 2008. He's charged with overseeing one of the 10th largest health systems in the country with more than 8,000 employees. Mr. Nask.
We saw the pictures, and we were convinced that maybe after 50 years we ought to spend some money, and that's when the debate began. At one point we considered a new hospital, and of course the cost of a new facility is about $1 to $1.5 million a bed, so that became cost prohibitive, and we felt like we had a good plan and maybe just some renovations, and we went through the process and came up with the $70 million project. And by the way, over that time frame, we've probably had 12 different board members to convince that we needed to do this. So that changed, and we had some years with some serious Medicaid reductions, so we had to figure out how much we can spend on capital. So the last 4 or 5 years to get to this point has been a journey, but over that time period, Pauline has done an incredible job of improving the culture. I mean, and these things are scored, and we get the industry scores on them. She's done an incredible job of improving the morale of the organization. She really got a hold of this, and really she didn't do enough justice to Dr. Ford's tours. I don't know if any of you have been on a tour with him, but he just, he grabbed me coming out, here, let me show you something, and he's running around the building, and here opening broom closets and things, and it's like, here, look in here. And I don't even know if he knew what was in there. He just opened the door and says it's got to be renovated. Shuts it. And so, with his energy as chief, and Pauline and her team, they actually got us to this point today. We provided some guidance and help whenever we can, but a lot of credit goes to her and her team and her commitment to the community and her commitment to this organization and the patients. So I want to say thank you. I want to say thanks to all of you that came today.
This will be an economic boom for this community. $70 million, yes, and we want to be sure that folks in the community are a part of the process. As Mr. Nask can tell you, sometimes I'm a pain in the butt at his meetings, at the hospital board meetings, but this is what it's about. The hospital is here to serve the community of Deerfield Beach and the community of Pompano Beach. Those are the persons who will use this facility.
Because of you, if there was no leadership, the board wouldn't feel confident to make this expansion in the community. And with the leadership and the confidence, I had no problem seconding Commissioner McKee's motion to make this $70 million plus expansion for this hospital and for this community. Thanks to you, Pauline. Great job. I'm happy to be on the board for the next couple of years and watch this become a whole new hospital and keep going on a great track. Thank you.
Been at the hospital for over 20 years, so I would see the doctors and nurses working on a daily basis. So when I had an opportunity to hear that things weren't good, I said, well, if you just take a look, and we'll show you what we have, because we have great services here. We have great doctors. We have a great team, and all of this is thanks to the leadership of Frank Nask and Pauline Grant. We appreciate that. Some of the commissioners, I know I would follow them around and show them things and tell them things, but we really believe in what we have, and as time has gone on, you've seen how well we've done. not only are we a community hospital, but a hospital that reaches beyond our geographical location to get other customers from, other patients from other facilities. But I am honored. I thank all of the doctors, and many of the surgeons have asked to have these new operating rooms. They were loyal to the hospital, and I'm just very happy, and thank you all for coming.
This is about dedication. I thought to myself, what is dedication? Dedication is a quality of being committed to a task. Dedication is seen daily by the amazing care our nurses, our ancillary services provide to our patients. Dedication is seen by the countless hours our doctors spend here at their second home away from their families. Dedication is seen by the efforts the administrative staff puts towards the hospital in making this a very safe and family-oriented place to be. Dedication is seen by the executives of Broward Health North, or Broward Health, and the commissioners with their faith in us and their support to our community and to financially back this massive endeavor. Together, all this speaks of the dedication we have for our community and for the people we care for in this community. I like to quote Jesse Owens, "We all have dreams, but in order to make dreams come into reality, it takes an awful lot of determination, dedication, self-discipline, and effort." I want to thank the entire hospital personnel for their determination, Broward Health Executives and Commission for their dedication, and the doctors and nurses for their self-discipline.
It is indeed an honor to be here and to serve as CEO for this hospital for the past 11 years. And I tell you, this project was worse than giving birth. It was very painful, but it was an outstanding process. It made us think about why we were doing this for the community, and it's because we are the community hospital for this area, and we want to provide the best care for our patients. Every day we come here, we think of the patient as a focal point, and as such, we felt it was important for us to do some renovations. So I want to take this opportunity to really thank Mr. Frank Nass for his support throughout this entire process. He's really helped us, guide us along, and then also to thank the commissioners for their support and for approving this project. I want to also thank our past commissioners, Commissioners Joe Koba and Mr. Clarence McKee, who were on the board at the time when this was approved. So I really want to say thank you very much for all that you do. This is a wonderful day for us, and I assure you that once we're going through this building, we're still going to be keeping the patient as a focal point. And with our physicians and staff, we're going to continue to serve the community and provide the highest care. So thank you very much. Thank you for being here and sharing with what is really an important day for Broward Health.